I feel like it's been a long time, right? Did everyone have a nice long weekend? No. I said no, right?
She asked me, I'm like, oh, no, I didn't say that. No, I didn't.
Well, I hope everyone is in there. I obviously see you. Ready? I see you today. And then I'll see you Monday. Obviously, I get to tell you have another good weekend after today. I wrote this up here. I'm going to talk about this at the end today. And I'm going to try to end like 5-10 minutes early. I have to race home to meet. We're having our roof redone today because it got destroyed from those wind storm that we had. So I have to meet with the guy at like 11:30. So like I just 5-10 minutes. So I'm going to try and end a couple minutes early, but I'm going to talk about that at the end so that you can start preparing for it over the weekend. And I know exams cause people stress, but hopefully I can make you feel a little bit better about it when we talk about it at the end. Okay. I can't believe we're already almost at exam 1. I was telling my class before, I feel like the class started very slow and now it just feels like we're rolling. It's going quickly. Like February is almost done, right? We're getting close to being done with February. Crazy. So okay. So we're gonna jump back to where we were. We left off here, right? We watched the little first moon party video, and we still have a couple of thoughts left with female anatomy. And then we'll move on to male anatomy today, and then on to Monday, and then Wednesday, we'll have that first exam. So we'll do this for both, but I want to talk about some of the kind of common health concerns. Some of the common health concerns for women, and then we'll do the same when we get to men. And then we also have the secondary sex characteristics, which we'll talk about as well. So when it comes to female reproductive anatomy, the doctor that you would go to is an OB/GYN, obstetrician, gynecologist, right? So they deal with all like female reproductive anatomy, along with like childbirth, labor, and that whole process as well, which we'll get into like a month or so down the line. But really important once you, like, you start doing regular checkups as a child, and then you do them as a teenager as well. But once you start to become sexually active, or by the age of 21, whichever one comes first, really important that you're having regular screenings for your reproductive health. And one of the ways that they do that for people who are biologically female is we do a test called a pap smear. And a pap smear, the full name is a Papanicolau smear after the doctor who coined it, but we call them pap smears for short. There's screens for different types of cancer, most commonly like cervical cancers. Well, we start doing the first one of these no more than 3 years after becoming sexually active or by the age of 21. Okay, so if you're having like any kind of like intimacy or like sex with other people, like whatever that might look like, you should be having regular pap smears or by the age of 21. Definitely not the most like fun procedure to have, but it is important, right? It's not necessarily painful as much as it's just uncomfortable. They do take a small little, like, it's almost like a large Q-tip, and they're taking a sample of the cervix. Now, if you remember, the cervix is a little bit up, right? It's the back end of the vaginal canal. The worst part of it by far, most people will say, is that they put you up in like stirrups so that they can access that. It can be relatively uncomfortable, not something that people tend to look forward to. but it is something that is important for your reproductive health. Yeah.
Don't they actually scrape out?
Yeah. Right, it's not necessarily painful, actually, like, if anyone has had one done, which I would hope many of you have at this point, some of you are nodding, they're looking very unhappy, yes, like, again, not fun, but it's not overly painful, they do like, it's almost like a rough, like, it's a Q-tip of sorts, but they take like a scrape, but it doesn't hurt, it's just the procedure's uncomfortable in the sense that you're very like vulnerable, and most people don't enjoy like that kind of position, yeah.
Something interesting, so these, the instruments that they use, they come in different sizes. A lot
Yeah.
of people don't know this.
That's true, yes.
They come in, so, if you've never had one and they just go in with a regular size, you know, like the average, it can be very painful.
Mhm.
And they won't proceed with what am I, procedure, thank you.
Sure.
They won't proceed with the procedure, they'll schedule you from another time and then they'll bring in a smaller.
Yeah, and
Yeah.
I mean, and that's a good point. There's a
Yeah.
variety of levels of this. I would say the average pap smear
Yeah.
is very like uncomfortable but not painful. But obviously everyone has different pain thresholds, different like medical like histories. So it can, we won't say it's impossible to be painful, but it typically isn't. But
Yeah.
there's obviously extenuating circumstances for everything. There were a couple of other hands, yeah.
So when I got my doctor told me like, obviously like, I think someone said like, you can take a little bit of the chunk like out of
Yeah.
it. So you have to like give your body time to heal.
Yeah.
And I had a friend that like wasn't told the same thing and was actually got an infection. So it just depends on like.
It depends on so many factors, yeah. Yeah, right, and so I didn't mean to minimize it, but more like normalize it,
Yeah.
but yeah, it can obviously be something that can lead to some complications, usually not, usually the worst part of it is the discomfort of the positioning and just the process, right? Like, and most people don't love going to the doctor, period, let alone going to the doctor, being put in stirrups and having like, you know, a Q-tip to take a small like sample this way. Is that a?
Yeah, I have a hilarious video that was all those just like an aftermath of it.
Uh-huh, you should email it to me.
Yeah.
Because, but it's good that you told me before you emailed, but yes, email it to me.
Yeah.
Please.
Find it.
I love it. Please send it. Yeah, if you ever have a great, like, something related to this class, send it to me. But yeah, give me a little preface so I don't like accidentally hit play, but while my kids are in the room or something like that.
It doesn't show anything, but it's like the way they do it is super creative.
Okay.
So it's, yeah.
Fun.
I mean, it would be fine for your kids anyways, but
Yeah.
maybe.
Right. Send it. I'll look forward to it. So, and
Okay.
oftentimes when you go in for like, a pap smear is usually done as part of like a physical, right? Which you don't do often. Like sometimes it's once a year, sometimes it's once every 3 years. It depends on a multitude of factors. But when you go in, they do something like a pap smear. They also typically do breast exams, which we'll talk about a little bit later. So it can be a whole day of fun, really. Like, I mean, honestly, going to the doctor can sometimes be uncomfortable and challenging, but it is a screening that should be done, right? And there's a lot of really amazing preventative measures and vaccines that we have now as well. My daughter, who's 12, got her first like shot for like a preventative measure. We went last summer and she got a shot. She's like, it was really painful. She stared at the doctor the whole time, like she was like really like intense about it. But oftentimes we have a bunch of really great like preventative things you can do. But by the time you're 21 or 3 years after being sexually active, there's a bunch of different conditions that can obviously affect women. One of the most common ones is something called PCOS. Really on the rise. It's something that a lot of women do struggle with on varying levels of severity. It stands for polycystic ovarian syndrome. It tends to be something that affects your hormones. People who have it have very irregular menstrual cycles. Sometimes it can lead to like other like health and like appearance related things like increased facial hair, obesity sometimes correlates with it. But this is something that is a very common endocrine disorder affecting a lot of women. Quite a few actually, like I said, the rates of it are on the rise. Oftentimes when you go to a gynecologist or even your primary doctor, we're looking for vaginal infections or urinary tract infections. The The vaginal canal is a very like sensitive, easy to disrupt environment. And so it's not uncommon for people to get urinary tract infections, yeast infections, vaginal infections, right? And so all of those things usually relatively easy to treat. But again, you would go to your primary doctor or an OBGYN to monitor those things. They're also looking for and screening for different cancers, a lot of different cancers that can affect people. When we're talking about reproductive ones, ovarian, cervical, and uterine cancers are the most common for women after breast cancer, which we'll mention later. So just important to be going to the doctor with some degree of regularity, even if it's not fun. Better to catch these things early than to catch them later. The other part of anatomy for women that we haven't talked about, secondary sex characteristics, like the breasts, right? So the breasts are a secondary sex characteristic, which means it develops later, right? So typically during puberty, you start to see breast tissue developing along with things like body hair, deepened voice for men, like the different things that indicate maturity that tend to come with getting that first menstrual cycle or shortly after, very hormonally based. But the breasts are a secondary sex characteristic that develop for women. Men can have breasts too. It's a condition called gynecomastia. It's not as common, but sometimes men do have more pronounced breast tissue. It's often correlated a little bit with weight and hormones. But typically we talk about this in terms of women. The breasts have two main functions, arousal and milk production. So a lot of women find like stimulation of like their breasts or nipples to be arousing, part of like a sexual like routine, but they have the main function of producing milk when a baby is born. So after a woman gives birth, all the different hormonal influences can cause them to produce breast milk, which they can feed their baby or babies with for a period of time. Something we'll talk about in that unit a little bit later. And I told you we're going to do this today, so I hope you thought about it. And if not, you get to think about it now. But I'm going to have you get back with a few people around you, 2, 3, 4 people, whatever it's easy. As many slang terms for breasts as you can come up with. There are quite a few, as there are for most pieces here. But write them down so you can share as many slang terms for breasts over a few minutes, and then we'll share them together. Just whatever's convenient around you.
I heard your will for sure. Oh, I heard your face. You always think always, yeah. I've always been like, back.
No, Melis is good. Twin Peaks. Boulders, yeah. Yeah, boulders. Boulders. No. Hitters, yeah. I have a bunch of hitters. I didn't want it. No, I wasn't. Fine. You did. You guys did that. Oh, down there.
Try out.
Oh, when I was a flower, I always think of planting. Or job, that's another one. But that's, yes.
I love the confirmation of like, yes, that one.
I heard it like when you're like referring to like the side. But is that not we're also getting yeah, it's just now. No, it's just. Oh, wait, no. Yeah, it's all right.
Oh.
Yeah, like, look, it's like.
Oh, yeah.
Fruit flavor.
And you have to move that.
Oh, okay. So pull her up right
I'll
now.
put,
I didn't see this.
That knock.
Yeah. Oh, wait, no.
Jug.
Gigolo. That's like a knuckle.
I'm scared now. This is hard one. Yeah, but that's just. Oh, yeah, the puppies actually goes right up about. Right.
Oh, yeah, it's all the day last summer. You know, that's a. It's a little fan.
Yeah, I would take something like this.
Yeah.
Yeah.
Okay, I'll be yours.
Okay.
Yeah.
It's not a random men's name.
I feel like there are.
Oh. Right. Oh.
Like,
I changed it.
Right, am I going? Let's switch to dramatic.
Takes me back.
It's not about that way. She's on play. He's like, look at
Yeah.
Stop having so much fun. Let's take this. Couple more minutes.
Let me help you.
Oh, yeah, because.
So.
I was like, I'm sorry for you. No.
Oh, yeah.
All on turkey. Turkey, that's all.
Yeah. No, one is a rose. Another is. But they don't have to show creative though.
I just got it, I just got this.
No. Like, they don't, what's the shape of like the rest of the
Like, I love.
Oh. Thank you.
No, I'm not saying it's like how.
Okay.
We're all going to first class.
Get your family.
Like. Okay, so. Imagine.
All right, are we ready? Got a good list? All right, if you want to go back to your spots or whatever, so lots of, I first some, but I want to do them, of course, and then we'll do one more later today. Slang for penis is coming in.
Yay.
Something to look forward to, respecting peanut rolls in the back of your mind. So anyone want to read their list? Yeah, all right, go for it.
We have titties, tits, knockers, tatas, bags, boobies, boobs, milkers, rack, melons, pillows, mosquito bites, balls, and reference to like size. Lumps, bazongas, chi-chis, pounds, mountains, peaks, hooters, bongos, and then Ashley came up with gigolo, which means something different. Wubble bubble balls, fat balls, anthills, and bongo chanclas.
I like it, very creative. So many, anyone else? Don't worry about the overlapping.
Boobs, memories, tatas, mommy milkers, tiggle bitties, titties or tits, booba, boobies, basketballs, melons, cherries, bee stings, bazongas, milkies, rack, tit tats, stress balls, mountains, calcium cannons, testicles, mosquito bites, breasticles, twin peaks, tetas, teats, jugs, boobage, bust, chest, mouth, the girls, tater tots, conquers,
Impressive, wonderful. Anybody else? Yeah, go for it.
Okay, titties, boobs, rack, balloons, honkers, knockers, coconuts, teats, boobies, busts, jugs, cannons, mammary glands, milk monsters, tatas, the girls, the twins, mommy milkers, bongos, Milky Ways, melons, tater tots, jingle bells, badonkers, twin peaks, maracas, boobage, lady lumps, hooters, dirty pillows, twins, coconuts, double D's, tits, assets, bazookas, grapefruits, milk jugs, and itty bitties.
We almost had like a poetry slam.
I know.
Like I should have music in the background, like I love it, right? So many, anybody else? I mean,
Can we add one more bodacious tatas?
Okay, I gotta add that in there, right? We don't wanna forget that one, right? So many slang terms, a lot of food references, right? And like the geographical references as well, kind of all over the place. Yeah.
So for the one that I come up with, which is Bubble Balls, I have a rap for it, and I was wondering if I could share it.
Yeah, but we got by all means.
My boobs are the size of a bubble ball. They bounce and they pounce, they make shots on the wall. You want them, you can have them, I got boobs for days. You wanna take a picture, send it over to the gays. They wiggle, they jiggle, they move left to right. Got my own custom bra size, all the others are too tight.
I would happily buy that system.
I know me too.
Right? Very creative.
Seriously,
Like,
that was great.
That was impressive. I will remember that moment for a long time. Excellent. I love it. I love it. I love it. I kind of want to hear it again. Okay. All right. Seriously. You recorded for part two.
No,
right?
get in the front and do it now.
Very nice, right? So again, slang for everything, right? I love it. That was very creative. So one last thing with this, and then I have a very, speaking of memorable, I have a very memorable video for you. But that's coming. You can look forward to that or dreading that in one of the other folk. A little bit more here about like breast care in a sense. Just like it's important to be doing pap smears and be going for like vaginal health and reproductive health. Breast exams are important too. Okay. And, you know, this is something that, as I mentioned, like a doctor will often do this as part of a physical exam, as part of like a wellness or physical check every year to 2 years to 3 years, depending on your insurance. But it should be something that you're also doing regularly on your own. Yeah. As soon as you start doing breast tissue, really. So like, I would say like once your breasts are like developed, like, so you know, it depends when you start like your menstrual cycle. I would say maybe 15, 16 should be starting to do this, because the hard thing with breasts, and people say this all the time, is like, well, how do I know? Like they're lumpy. Like, so like, what am I feeling for, right? And so breasts naturally are very lumpy tissue. It's a lot of fat tissue, so there are lumps in them. But what you're feeling for is anything out of the ordinary, right? And so if you know your body well, you know when something is different than what is typical. And the other tricky part of that is a lot of women, when they go through like different parts of the month and that hormonal cycle, their breasts can become tender at certain parts of the month. Foods that you eat can affect the amount of lumps that you have in tenderness. A lot of caffeine, alcohol, and sugary foods can make your breasts naturally more tender or painful. Some people just have more of that in general. So the better that you know your body, how it is normally, the better you'll be able to detect if something is different. Okay, and so you can make this fun. It doesn't have to be like a tedious chore. Like have a partner help you do a breast exam. Like why not? Right? Like, and it can lead to other things if you want. Right? So it should be something that you're doing regularly. Like, and so if you notice something that isn't normally there or something that's different, you know, that's when you would want to go and have a doctor check it out. Yeah.
Okay, this is like a multiple part question, but first, what causes an abscess in the breast?
Uh-huh.
And then, like how concerning is an abscess in
So-
terms of like other concerns?
What do you, so what do you mean by like an abscess? Like
It's
just,
like, okay, I had a friend who like felt a lump in her boob.
Sure.
And she was like, oh my gosh, I have cancer. And I was like, you don't have cancer.
right.
So she went to the doctor and they were like, you just have an abscess in your boob. It was
Yeah.
basically like a sack of like pus.
Like a cyst. Yeah.
Yeah.
Okay.
And they had to like just poke a hole in it and just like suck out the pus. And
Yeah.
It like shrunk her boob too.
She's like, how dare you, right? Yeah. And that's the tricky thing. So if I go back a slide here, right? If you look at all the tissue that makes up a breast, it's made up of glands and like all sorts of little like polypy kind of things anyway. And so what happens is sometimes those mammary glands or other glands in there can get clogged almost, and it creates like a little pocket of pus or pocket of like fluid that sometimes needs to be drained. Oftentimes they don't need to be drained. They're just kind of there. A lot of women have like lumps in their breasts that are always there. They don't hurt. They're not problematic, but sometimes it can lead to like a little abscess or a polyp or a cyst. And cyst sounds like cancer, but it's not always cancerous. It could just be fluid, right? And so that happens pretty often, actually. So my partner was like 4 years ago, had a lump in her breast and it was hurting her. And she went to the doctor and they had to do like all the time. We thought it was cancer. Like I was freaking out. Like she was freaking out. It turned out it was just a fluid filled sac that they had to drain. And that obviously was painful to do, but now it's gone. But they had to like do all that process. That happens a lot, right? They can get clogged. No, not necessarily, right? Breast cancer does sometimes run in families, but it's also the most common form of cancer affecting women, right? And so unfortunately, it is just something that you have to be very on top of. Doctors will do regular breast exams, but you're gonna know your body better than they are. And again, very common, like, as I was mentioning, there are apps that you can track, like for your menstrual cycle. There are often periods of the month where like breasts are naturally more painful or tender. And knowing that can take some of the fear out of it. It can make it more like normalized for you too. Yeah.
And just to go off of that, so I had my first mammogram like in December, and they found a little cyst and they wanted to, you know, do a ultrasound on it. And basically, how common it is, I just want to say is that, so when I called my best friend to tell her, oh, I have a cyst, it's not cancerous in my left boob, and she was like, oh, I have a cyst in my left boob too. So yeah.
Cis sisters, right? Yeah, right.
It's like,
That was hard to say, right? Yeah. Yeah, it really is unfortunately quite common, right? And having like sensitive breasts can be quite common as well, especially at different, like I said, different times of the month. And diet plays a huge role in that as well. And you mentioned a mammogram. A mammogram or a mammography is the test that we would use to detect breast cancer. Now, typically, it depends on your family history and your reproductive history and your health and like a lot of factors. But typically by the age of like 35 to 40, they recommend that you have your first one if you haven't already. If breast cancer runs in your family, it might be much, much sooner. I will say that mammograms can be painful. Okay, they basically take your breast, put it on a plate, and smash it. Okay, there's, sorry, there's no sugarcoating that. So there are some newer methods that they're developing. This is kind of the standby. So you can see the image here and the woman standing behind it. There's a machine with a clear plastic plate. And what happens, it takes an X-ray. That's what they're doing. And so you put your breast on the plate and you bring the machine down and squish it so that they can get an image. Now, that can be painful. Like I won't sugarcoat it. I thought it was quite painful personally, but everyone like goes through that and has a different range of like tolerance. There's a newer method that they're starting to do. There's a table that you lay stomach down on and your breast goes through like a hole. And then the machine comes up underneath you and it doesn't hurt like this one, but most insurances, it's this. That's only like in some circumstances. If you're quite young or you have very small breasts, sometimes they do ultrasounds as instead. But that's typically when you're quite young, where if you're very small chested enough that you don't have enough tissue to switch. Yeah. We should be getting if you run, no, not like, so typically like, so I have Kaiser, like as my insurance, they recommend it by the age of 35. I put it off for 5 years and did it at 40, right? But like by 35 or so, like they recommend that you start doing that if you haven't already. Unless you have a history of breast cancer in your family, in which case they might suggest it earlier. Or obviously if they find something that they want to investigate, it will be done. Right. There's a couple other, any other questions? I did with ultrasound. Okay. Yeah, and so again, not a comfortable procedure, but it's important. If you catch stuff like this early, you can often do a lot more than if you catch it later. Right now, so obviously like breast cancer can be fatal, it's cancer, but oftentimes if it has spread to the entire breast, they can remove a breast, which is called a mastectomy, or both. Sometimes they can reshape a breast or do plastic surgery to reconstruct one. My aunt had breast cancer and a really like positive person, like somebody who finds a silver lining and everything. And she went in and she had breast cancer, sadly was quite like far along, and they had to remove both of her breasts. But then she's like, but they took all the fat from my stomach and made me 2 new beautiful breasts, and I lost my stomach fat. She was like, just like it was a win, right? Like, what a positive individual, right? Right? She was winning at life on that one, right? She's like, I lost my whole stomach and I have 2 beautiful new breasts at like 60, right? So, you know, there is often like reconstruction that can happen, and that's possible in plastic surgery if it comes to that. But catching these things early you obviously have a lot more options than if you catch it late. So as much as it might not be fun, it is important to do regular like mammograms and checkups. They would only do a mammogram again when you're older, or if there's like something that they detect. Typically it's more just like a physical, like with your hand breast exam, unless there's something that they detect and need to follow up on. Okay? So important to be doing these things, even if they're not the most fun. Again, you want to catch it early. So I have a video for you, and I debated whether or not to play it, but I had to listen to this music, so I'm gonna make you listen to this music because I had it stuck in my head for like a week. Really like obnoxiously catchy music, right? I liked your music way better than yours. So the cool thing I like about this video, so it's a documentary made about breasts. It's getting a little old, but I still think it's amazing, right? So what they have is a bunch of women who are willing to take their shirts and bras off, sit there and talk about like breast expectations, breast size. There's some slang in there. I'm only going to show you about 12 minutes or so of it, but I do think it's really vulnerable and really like powerful. So I have the male equivalent if we end up having time for that. But here, let me bring this up. And it has horrible music. I'm so sorry. What was that? What? Okay. All right, so I'm gonna pause this, and then, like I said, I'm not gonna play all of it, just the music, I'm sure, right? Hopefully it lived up to all expectations, but what I love about that, like I know it's getting a little bit old, but like the vulnerability that they showed, just imagine sitting topless next to your mom on film, right? Talking about your breasts, right? Like, or I guess they don't quite do the same with the male equivalent. They take off their pants, but then it's like a bunch of guys sitting around talking about their penises. So you can look forward to that if we have time. But what I love about this is just that vulnerability, talking about, you know, size and development and like societal pressure. A lot of pressure for women on the appearance of their breasts, the size of their breasts, similar for men with like the size of their penis, right? So a lot of like societal like norms and expectations. And I love the vulnerability of that just to kind of close up this topic. Any other like thoughts or comments or questions or anything else about female reproductive anatomy or anything here before we?
Well, I don't know, I found that really interesting because I feel like when, you know, just walking around as a woman, like I would say that I like notice other women's like size and, you know, just as you're walking around. And like, as I was a kid too, like my mom was pretty small chested, so I wasn't like, my little kid brain like couldn't comprehend that like some women just like have bigger breasts.
Sure.
And especially like most people, especially if they do have larger breasts, like will be wearing a bra like for support and everything. So that was honestly the first time that I really saw like, you know, how they came naturally and just how like they really come in so many shapes and sizes. Like,
Yeah.
you know, we really don't get to
You don't
see that, I guess,
normally
you know,
witness
so,
that, right? Yeah, and I think too, just like I like that they got a range, you know, and if you keep watching the documentary, like you even have people who have like lost breasts or have one of them removed or both of them removed. But I love that they have, you know, people who never wear a bra or never wear one, and then people who are like, I have a sports bra, even though it's sports, you know, like, I love that she said that, but she doesn't jog. But you know, just like a whole range, but it's just like with anything else, like everybody's so different, right? And you might not, you know, ever have a chance to see that except for things like this. Yeah.
I love how respectful the whole thing shot.
Yeah, me too.
Nothing else to add, just made me very happy.
Sure. Yeah, I won't say that I feel like the one with men has less maturity to it. But I do like the way that they did it. And I like that they had children all the way up to people who were older, like just a good diversity, which I think is great.
This one, they're not happy yet.
Mm-hmm.
I like how it wasn't just about your experience having it, but just your experience of potentially having it.
Right.
Having had it for a long time.
Yeah, me too. I think that is nice. The nice vulnerability. And again, it's not something that people I think tend to openly talk about a lot, but it is something people think about a lot and sometimes notice as well. So with that, we'll move on. We don't have a ton of time left, but we'll start male anatomy. today. So we'll get into some of the equivalents for men, kind of looking at external, internal, male anatomy. We'll talk about sperm production, which would be kind of the equivalent of the time we spent on menstruation. So looking at internal and external male anatomy and some of the kind of similar things here. So, and interesting, I think a lot of people tend to have this thought that like male anatomy is less complicated. It's not, right? Like if you look at this, there's a lot of elements to male reproductive anatomy, right? Internal and external structures. So we'll focus on both. But we'll talk about like some of the external ones today and then get into sperm production and internal ones next time. But a lot of different structures, a lot of different glands and tubes and pieces and ducts, right? Like that we're going to talk about here as well. So if we start with external anatomy. Okay, so external reproductive anatomy for men. Obviously, the main sexual organ for men is the penis, right? So it'd be the men, like a man's like main sexual anatomy that we're focusing on, consisting of the internal root, the external shaft, and the glands. So made up of a couple of different pieces. So we have the shaft, the glands, and it's made up of a lot of spongy tissue. That is the primary like bulk of what the penis is made up of. But you can see the shaft of the penis is like the body of the penis. We have the head of the penis or the glands, and then the roots at the back. And the root is the part that connects to like the abdomen. And it has very strong muscles and tendons that we call crura, which are up there, right? So crura is Latin for leg. And the very strong muscles that connect the penis to the internal muscles of the body, very strong tendons, right? A lot of like muscular responses when we talk about ejaculation and erection, which we'll get to next time. A couple other things here, right? So as I said, the external anatomy, we have the glands. The glands is the head of the penis. It tends to be the most sensitive. Another name for that, the corona, we talked about that in that little like sexual intelligence quiz. If somebody asks you if you like corona, you might want to clarify, right? Corona is the head of the penis, right? It's the rim or outer rim. It means crown, technically, if you translate it. The penis itself is made up of a lot of like cavernous bodies and spongy bodies. And you can see them in here. These cavernous bodies and spongy bodies fill up with blood when a man becomes aroused, which causes them to become erect or have an erection. Right, so we see a lot of these bodies that make up the bulk of the body of the penis, which we would call the shaft. The root, as we said, has the crura at the back, those strong tendons. The foreskin, let me put this up here. And we'll talk about circumcision a little bit next time. But the foreskin is that like covering, it's that skin that's covering the head of the penis. And this is what would be removed during a circumcision. No, that's one too. Circumcision, look, it looks good there. You can just figure out what it means. Now I have marker all over me. Right, but that's what would be removed during a circumcision if a boy is circumcised, which we'll talk more about next time. A little different from the way the Egyptians invented it, which was during the teenage years. Circumcision now is much, much younger, thankfully. The corona, again, the rim or the crown of the penis. The frenulum is this little stretch of skin underneath the penis that connects the head to the body. So a lot of different like elements here, the main part being the shaft of the penis filled with those cavernous bodies connecting to the head or the glands as well. I think we have time. I told you slang for penis. So if you want to find a couple of people around, they could be the same group, or if you want to mix it up, that's fine too. But write down all the slang terms you can come up with for penis. Circumcision. I swear.
Yeah.
It's like you use there was an episode Sextmire that I saw when I was like 14 or something, where this guy was talking about, oh yeah, like using this, we did have. That was the only one. Yeah. Yeah, it's never. Like, oh, I said, like, if your name is Robert, like, you're on something. Yeah. I don't know what that.
Snake.
Snake.
Third leg.
It's like there's somebody.
Every little boy.
Fire hose. Long.
How many rhymes can we get?
Spanish one.
Oh, yeah. That is why you're slowing down. Oh, you got wiener, you got.
Take a couple more minutes, couple more minutes.
I'm not kidding, these are.
Yeah.
Oh, yeah. When I really. The hammer. Hammer. Oh, awesome, thank you. Like, pay attention.
I had the little guy that category.
Molly, going stick. Not, yeah.
I'm just going six.
Oh, yeah.
Say no.
Sure, why not?
Say no, there's in the category. No.
Yeah, same.
Yeah, no, that's cool.
Oh.
Big stick.
Like the. Oh, yeah.
No. Garden.
Look at me.
You said that, it's garden. Sperm eggs.
All right, in the interest of time, I was gonna say, I'm gonna cut you off, but I felt like a bad time. So, how do you do? I'm gonna have you hold on to your list. Whoever wrote it down, make sure you bring it on Monday. Because I want to take 1 minute to talk about this so that you have time over the weekend to start thinking about the exam and prepare. I don't want to forget that. So hold on to your list and then we'll pick up with this when I see you on Monday. But let me take just the last couple of minutes that we have here to just talk about our first exam. So our first exam is coming up on Wednesday, and I'm sorry for those of you having for 2 classes and hit them both on the same day. But on Wednesday, we won't have class in person. So I started doing this during COVID, and I think it is so much less anxiety. I hope you agree. I know exams cause people an incredible amount of stress and anxiety. I wanted to be really sensitive to that. So our exams will always be on campus. So what that means is on Wednesday, we won't have class. I'm giving you the hour and 15-minute class time to take the exam online. With that said, I will be opening the exam at 12:01 a.m. on Wednesday. It'll close at 11:59 p.m. So if you would rather have a nice lunch or like really sleep in or do whatever it is that you would rather do, you don't have to take it during this class time, but I'm giving you that time to take it. Okay, so you have all day to take it, but it needs to be done by 11:59 p.m. when you close. Otherwise, it'll be too late. So when it comes to the exam on Wednesday, I'll send out a reminder Tuesday night, just in case you forget. But Wednesday it'll open up, you'll be taking it online, we won't meet in person. I want to show you on Canvas, if you're on our website, if you click on modules, I've given you a study guide for the exam. So see right here at the top, here's the syllabus. So here's the study guide for exam number 1. And what I would really recommend is that you use it to prepare for the exam. Yeah. Yeah. So I'll see you Monday and we'll finish up chapter, we'll finish up the chapter on male anatomy and then Wednesday, but I want to make sure that you going into the weekend, if you wanted to start the study guide or preparing, that you have that time. So if you click on the study guide, if it's on here, it will be on the exam. So what I've done is go through the exam and write down every key term that you need to know. If it's not on here, you don't need to study it. You don't need to know it. I won't ask you about it. I promise it won't be on there. So the exam's on chapters 1, 2, 4, 5, and 6. Basically everything that we will have covered by the end of Monday. It's a mix of things from the textbook and the lecture. So if you don't recognize it from lecture, that means it's in the book. But if it were me, what I would do is go through and I would write out or type out each one of the terms on here. And if you've done that and you study that and have it in front of you, there's no reason that you won't do fantastically. I don't believe in trick questions. I don't believe in making exams artificially difficult. I think if anything, I think this one's a little bit harder than the other two, just because there is some anatomy that you will need to be matching. But if you know these diagrams, which are in the slides, and these are the exact diagrams from the test, you'll be fine. You don't have to spell anything. I did fix circumcision, by the way. You don't have to spell anything. You just will be matching it to a list. Okay, so make sure that you know everything that's on here. The exam's mainly like multiple choice, true, false, and matching with a few short answer questions. But the short answers aren't essays, they're like lists, right? Like what are the 4 components of sexual intelligence? I think you can kind of, like, you'll start to see them on the study guides, I think, if you look. But as long as you study and prepare with this, you should be in really good shape. You can use your notes, you can use your book, you can use your completed study guide. And the biggest reason I would recommend doing this is then you don't have to go look in the book or the lecture or the slides. You're not using up that valuable time. If you're trying to look up every answer, I promise you, you will run out of time. But if you've studied and prepared, I really think you'll do quite well. People tend to do quite well. I would be thrilled if you all got A's. So I want you to succeed. I'm giving you a study guide to set you up. But if you would like to start preparing and studying over the weekend, this is available for you. And then on Monday, I'll see if you have any questions. We'll kind of, I'll touch base on this again. We'll start with your slang. So again, bring that with you and you're welcome to add to it over the weekend if you think it's something, right? So I'm going to stop there, but I'll hang out for a minute if you have any questions and then we'll pick up again on Monday. So have another wonderful weekend and I will see you on Monday.
I think we're going to have this.